Okay, so let us start the neurologic assessment with a review of anatomy and physiology. Okay, so what are the general functions of neurologic system? Okay. It includes your cognition. Okay. Ano ba yung cognition? It's your ability to learn something, ability to read, to write, okay, gumawa ng mga kilos, ay isa sa mga cognitive ability also. Okay. So another function is your emotion, kalipayan, okay, happiness, fear, anxiety, love, hatred, joy, are all emotions, and memory. So another function is your sensation, or the ability to use your different senses, such as your sense of touch, sense of optic, okay? And then we have your sense of hearing, sense of smell, sense of taste, savory, okay? Light perception, okay? Sensation perception is the ability to receive stimulus and then to perceive, okay? The ability to receive stimulus and to perceive such stimulus in a coordinated manner. Halimbawa, napasok ka, it's a sensation. So what is your perception? Your perception is is the ability of your brain to identify that you are in pain, that you contacted a burning sensation, okay, or a warm or hot surface. Okay? So ganun yung perception. And then integrations of sensory perceptual experience. So integration of sensory perceptual experience and memory. Okay? So paano ba i-integrate yung sensory perceptual? So pag napasok ka, next time, hindi mo na gagawin. So there is automatic in a sense na magkakaroon ng learning during the integrations of the sensory perceptual experience. Then we have the regulation of your homeostasis or the body equilibrium. What is homeostasis? Is the wellness state of your body. It's not just the balance or the equilibrium of your sense of balance, okay? It is your totality, the health status of the patient, okay? So homeostasis or balance of the health status, the wellness status of a patient, okay? Another is consciousness, another function of your neurologic system is to maintain consciousness, okay? To maintain your body temperature, the blood pressure, and other bodily processes, okay? So isipin nyo na lang, so yung neurologic system, okay, hindi lang siya basta central nervous system. It includes also your peripheral nervous system. So neurologic system is from the head up to the every surface of your body. Okay, that's neurologic. Okay, so there are two types of nerve cells. You have the neuroglia and then the neurons. Okay, so what is neuroglia? So yung neuroglia, it functions as supportive tissue, nourishing and protecting the neurons. Sabihin, kung ito yung neurons mo, yung neurons kasi natin, merong paano ko ba gagawin to? So kung ito yung neurons mo, meron siyang mga, ganito natin. Ito yung center of your neurons. Okay? So meron kang dalawang appendices dito, yung mga nakalawit. Okay? So sobrang bahagi. So one is your dendrites, the other one is your axons. Okay? So ano yung ginagawa ng neuroglia? Ito yung nagko-covers ng myelin. Okay? Siya yung taga-cover ng axons. Okay? So ganun yun. Including also the oligodendrocytes of your dendrites, axons and dendrites. So myelin, oligodendrocytes for this one. So yun yung gumagawa. yung neuroglia mo. Okay? Nourishing and protecting. Imagine your wire. Yung wire mo, merong copper sa loob, kaya aluminum. Okay? So ano yung wire? Yung electrical wire yung sinasabi ko. Merong copper sa loob, merong aluminum. Tapos sa labas, merong coating na rubber type. Okay? So one is conductor, the other one is insulator. So neuroglia is your insulator. Okay? It protects the neurons. Another function of your neuroglia is to maintain homeostasis in the interstitial fluid around the neurons and account for about 50% of the central nervous system. So yung pagagawa, binabalance din nila. They have the ability to regenerate and response to injury by filling spaces left by damaged neurons. So once ng neurons ay magkaroon ng damage, pinupuno nila yung damage na yun, yung space na yun, pinupunuan nila. Okay? O sila yung taga-tapal ng mga butas. Okay? Kasi kung merong butas, lalabas yung electrical impulses, magkakalat. So, tawag natin doon sa mga, diba, pag naugurintic, merong grounds. Okay? So, pag nag-ground ka, hindi maganda, pipitik ka. Okay? There are reflexes na mangyayari. So, ganito rin yung nangyayari sa mga cells. So, once ng electrical impulses, mag-ground yung ibang cells, pipitik yan yung ibang parts ng body na hindi dapat inuutusan o hindi dapat magkakaroon ng movements. So, magkakaroon ng jerky movements. Okay? There are reflexes also originating from your cells secondary to impulses na lumabas dun sa dapat nasa actions lang, nasa dendrites lang yung daanan, pero lumabas sila dahil walang neuroglia. So what is neurons? So aside from the neuroglia, which composes the biggest part of your neurologic system, have also the neurons, the most important also, okay? Part of the neurologic system. So the function of the neurons, it has the ability to produce action potentials or impulses or excitability or irritability. So kung wala sila, kung wala yung neurons na yon, walang taga-receive, okay? Walang taga-kuha, walang taga-bigay, okay? To receive and to transmit impulses. Okay? Halimbawa, napasok ako. So pag napasa ako, kung wala kang neurons, hindi yun aabot sa brain mo at ma-interpret as pain sensation or burning sensation. So walang mangyayaring ganon. So ano yung tendencies? I-maintain mo yung contact sa hot surface at ikaw ay magkakaroon ng injury. Unlike kung meron kang neurons, there is transmission and then it will be received, then magkakaroon ng sensory perception process. Okay? So, ma-identify na merong hot surface occurring, causing cell injury to your hands. Okay? So, magkakaroon na ng withdrawal reflex. Aray. Tatanggalin mo ang kamay. Tanggal or aray. Okay? Pag-uusapan din natin. So, it has the ability to produce action potential or impulses. Okay. Ang tawag natin dyan, excitability or irritability, and to transmit impulses or the so-called conductivity. So, from your hands, okay, from your tongue, up to the brain, sensation of kung anong lasa. Pasok sa tenga, okay, process sa utak, malalaman kung ano yung narinig. Okay? Iba't ibang parte ng katawan. What's up, Coco? Para hindi antok. Okay. So this is your neurons. Okay? So, nasa naman yung neuroglia. Neuroglia, ito yung nasa side, nasa gilid. Okay? So, ito yung taga-takip. Okay? Taga-cover natin. Okay? So, without this one, okay, ang mangyayari magkakaroon ng grounds. Kasi dapat yung kuryente, yung electrical impulses, dito lamang dadaan. Okay? So kung ito yung end, yung cells mo, ng muscle cells or skin cells, okay? Papasok dito ngayon yung impulses. Okay? Halimbawa, kung ano yung na-feed, papasok dito, dadalhin papunta dito sa neurons. Okay? Tapos, ipaprocess na naman dito yung dendrites. Okay? So, bibigay ng dendrites papunta pa agad. Okay? So, to receive your impulses, okay? Ito yon, pasok ng axon. So, anong mangyayari pag nawala ito? Magkakaroon ng tinatawag na multiple sclerosis. Nawawala ng myelin sheath. Okay? So, yung dendrites naman, kung nakakover dyan, is oligodendrocytes. Okay? So, yung myelin sheath is composed of your Schwann cells. Okay? So, pag namatay yung Schwann cells, wala kang myelin. Okay? So, meron kang mga dinadaanan dyan na nodes of Denver. Okay? Okay. So, we have the nucleus. Okay? Nucleus. Okay? Ito yung total cell body. Okay? Then you have your extremities. Okay? The dendrites. Dendrites, madami yung dendrites, kukunti yung axons. Okay? So once na na-damage yung isang bahagi ng dendrites, madami pa rin other dendrites. While yung axons, pag na-damage, okay, kaya mas malala yung epekto sa multiple sclerosis kasi kukunti yung dendrites, yung axons. So, in this case, isa lang yung taga-kuha ng impulses at sa taga-bigay din papunta rito sa muscles. So, kung once na ma-damage to, magkakaroon na ng problema. Okay? So, ganito yon. Receive ng muscles, identify ng brain sa taas, tapos babalik na naman, it will be transmitted papunta rito sa skin cells. Or, pwede rin ma-receive ng skin cells, dadalhin papunta doon, tapos magkakaroon ng action yung muscles via your contraction, muscle contraction. Okay? So, ganun yung proseso ngayon ng transmission and perception of your cells. Okay? So, in every cells, meron tayong tinatawag na synaptic cliff. Okay? From one cells, okay? Kung kita mo to, okay? From one cells, from one neurons, merong spaces dyan. Okay? Merong spaces dyan. Okay? Para saan yung spaces na yan? Yung tinatawag natin synaptic cliff. Okay? So, nakaganito sila. So, hindi sila totally magkadugtong. So, nakaangat yan. Okay? Merong, do I define this? Merong space. So, merong space na in between your dendrites or in between your neurons. Okay? So, ang gagawin dyan is it will release your neurotransmitter. Okay? The neurotransmitter yung magdadala ng impulses. Ang tawag natin dun sa neurotransmitter na electrochemicals. So, yung electrochemicals na yun will be discussed in one of my slides or one of my PowerPoints or video. Wala. So, one of my videos regarding neurotransmitter, the different neurotransmitter. Okay? So, ano yung neurotransmitter doon? Kasama doon yung dopamine, epinephrine, norepinephrine, kasama din dyan yung GABA, glutamate, makakuha natin sa bitsin na hindi maganda para sa katawan. Okay? So, it will be discussed in my other PowerPoints video presentation. Sorry. Okay. So, meron kang synaptic cliff. Okay. So, yung tagapagdala niyan, meron kang neurotransmitter. Without this neurotransmitter, okay, magkakaroon ng problema also yung transmission from one cells to another cells. To another cells. Okay. So, ganun yung mangyayari. Okay. So, Meron din tayong tinatawag na reabsorption. It will also be discussed, pero ano na lang natin dito. So sa reabsorption, once na nagbigay, okay, ba, dalhin kita, meron akong impulses, okay, dalhin ko papunta sa kabila. Dalhin ko papunta rito sa kabila para umabot hanggang dito yung impulses na yun or umabot ng brain. So kung sobrado yung binigay ng neurotransmitter, okay, pag sobrado yung neurotransmitter sa kadahilan ng mas madami siyang ginawang neurotransmitter or maaaring normal yung ginawa ng neurotransmitter pero pupunti yung receptor pagdating dito. Okay? Pupunti yung receptor. Kaya maaari ding normal yung number of receptor dito. Okay? Yung mga dendrocytes na yan, normal yung dami. Kaso nga lang, yung nangyari is mas kukunti yung produce na neurotransmitter dito. Okay? So ano yung mangyayari? So pag kukunti yung neurotransmitter, hindi magiging sakto yung transmission. So the result will be mas kukunti rin yung perceived, okay, effect. Okay? So kukulangin ng response pabalik. Okay? Halimbawa, meron kang bibit-bitin na mabigat na bag. Okay? Normal yung neurotransmitter mo pero kukunti yung recipient mo. Okay? So the result is manghihina ka, hindi mo madadala yung bag. O kaya maaaring meron kang dadalhin mabigat na bag, yung neurotransmitter mo is kukunti yung release. Okay? So yung tendencies, yung release ng neurotransmitter dahil kukunti, yung action potential na gagawin is mas kukunti rin. So mahina ka rin. Okay? So ganun yung nangyayari. So it will differ in your Alzheimer's and your myasthenia gravis. Okay? So doon sa isang slides, maririnig niyo yung regarding sa Alzheimer's and myasthenia gravis, the difference. Okay? So ganun yung nangyayari. Okay. So ganun kahalaga yung mga neurotransmitter. Okay. So neurons band together into peripheral nerves, spinal cord, and tissues of the brain. Kaya nga yung neurologic system is nakakalat sa buong katawan, hindi lang sa utak. Okay? Neurologic system involves your brain, spinal cord, the spinal nerves, the peripheral nerves. Okay? Kalat sa iba't ibang parte ng katawan, sa iba't ibang organ ng katawan. Okay? Okay. So, with the involvement of neurons, kaya nga sinasabi ko, during my pagkahawa ko sa anong tawag natin dito, yung para sa return demo, yung papel, okay? Yung checklist, pagkahawa ko, sabi ko, kung i-discuss lahat yung neurologic system will be involved. Sa neurologic system pa lang, it is a head-to-toe assessment. Okay? Sa neurologic system pa lang, head-to-toe assessment. Okay? So nga lang, dahil separate system siya, we have to discuss neurologic assessment. Okay? Kaya hindi ko sukat nakalain na in head-to-toe assessment, i-involve yung neurons. So, magkakaroon ng redundancy sa discussions at saka sa redundant, magiging paulit-ulit yung physical examination, magiging paulit-ulit yung discussion, kasi nga, yung neurons, it involves the whole body. Okay? It involves the whole body. At it will involve also all the different functions of the organ. Okay? So, hindi lang yung mismong organ, okay? Hindi lang yung structure yung involved sa neurologic system, but also the function of the whole body system. So these structures make up the neurologic system, which is divided into your central nervous system and then the peripheral. So central nervous system from the brain to the spinal cord, peripheral nerves to the spinal nerves or the so-called STT or spinothalamic tracts. Okay? Okay, so for the central nervous system, okay, ito yung consist natin of the brain and the spinal cord. Okay. Okay, so we have the human brain. Okay. Okay, so regarding the human brain, okay? So meron tayong tinatawag na temporal lobe. So dyan makikita yung hearing, smell, taste, memory, speech compensation, or the so-called your Wernicke's area. Okay? So in the Broca's area, dyan naman yung motor speech area. Yung paggalaw ng dila, sama dyan. Okay? So we have also the frontal lobe for the emotion, behavior, and intellect. Okay? For the lateral fissure, nakikita yung kaibahan, okay? Ng frontal at saka ng yung location, that is the lateral fissure that separates your frontal lobe and your temporal lobe. Then we have the central fissure separating your frontal to your parietal. Okay? Then we have also your occipital para sa visual perception. Na pag pinalo ka dito, maaaring ikaw ay mabulag sa likod ng ulo. Okay? Then you have your cerebellum. Napaka-importante during cases of cerebrovascular accidents assessment kasi ito yung coordination, equilibrium, and balance. So once na-apektuhan yung cerebellum during the cerebrovascular accidents, posible ang pasyente ay tumumba. So pag tumumba yung pasyente, ibig sabihin, nagkaroon ng problema sa equilibrium dahil yung tinamaan or nagkaroon ng brain injury during the cerebrovascular accident or cerebellum. Okay? So, dyan din makikita sa cerebellum area, malapit yung midbrain at saka brainstem, which is, yung function is a regulation of your breathing. Okay? So, pag tinamaan yung cerebellum, then this is maaari din tamaan yung midbrain at saka yung brainstem. So, magkakaroon ng respiratory depression. So, yung pasyente na nagkakaroon ng cerebrovascular accidents, unlike other cases of cerebrovascular accidents na yung tinatamaan sa frontal, okay, or the other parts of the brain that involving your midbrain, brainstem, and your cerebellum, namamatay agad, katulad ni Fernando Po Jr. Okay? So, nagkaroon siya ng stroke, okay, yung tinamaan yung cerebellum, midbrain, at saka brainstem, because of those injuries in those areas, namatay agad. Okay? Secondary to respiratory depression. Yun yung kaibahan ng cerebrovascular accidents sa area na yan. So pagkaliit-liit ng area na yan, ang laki ng epekto. Okay. In some cases naman, yung tinatamaan, yung emotion, yung behavior, or yung intellect, kaya nagkakaroon ng differences sa sensory and perception. Okay. Yung coordination, perception, and coordination nagkakaroon ng maladaptations or disturbance. Okay? So ito yung mga pasyente na kahit gustong damputin yung baso, hindi niya maigalaw yung kamay mo, kaya kakaroon ng paralysis or halimbawa, sinabihan mo, nagsalita ka, tapos iba yung response sa'yo. It is because of yung perception niya, dun sa stimuli, yung narinig niya, iba yung pagkaka-proseso ng utak dahil tinamaan yung frontal area, yung intellect. Okay? So, ganun yun. Okay, so in cases naman na yung tinamaan is yung motor cortex, okay? Yung pasyente ay napaparalyze. Okay? Maaaring maparalyze. So, ano yung paralysis? Usually start with your so-called flaccid paralysis. Tapos, sinusundan na ngayon ng flaccid. The other one is yung rigid paralysis. Okay? So, ano yung kaibahan ng flaccid sa rigid paralysis? In the early stages of paralysis, flaccid muna, malambot yung katawan. So, kahit hindi maigalaw ng pasyente, with your passive exercise, okay, with your support, okay, yung pasyente, kayang i-flex at saka i-stretch yung mga joints and muscles. Okay? While in rigid paralysis, pag tumagal yung paralysis na hindi nagagalaw yung katawan, the result is magiging rigid. Titigas na ngayon yung paralysis. Kaya makikita ninyo yung mga pasyente na pag naglalakad, halos hinihila at saka ini-islam yung paa dahil hindi niya na unang-una hindi niya na maigalaw dahil merong paralysis at pangalawa hindi na niya flex yung paa, okay, during walking. So tendencies, straight yung kamay tapos parang umiikot, okay, or creating a half circle during walking, okay. So gumaganon yung paa. So, tapos i-islam yung paa pag naglakad. Okay. So, ganun itong nangyayari. So, iba-iba yung tinatamaan ng cerebrovascular accidents or tamaan ng cell injury. Iba-iba rin yung epekto sa katawan. So, that's why yung mga nararanasan ng iba na nagkakaroon ng cerebrovascular accidents may be different to the other. Kasi depende yun sa areas na nagkaroon ng cell injury. Okay? O ng brain injury. Okay. So, let's go to your spinal cord. Okay, so the spinal cord descends through the foramen magnum, right, or the large aperture, the occipital bone of the skull, through the first cervical vertebra, or which is your C1. Okay, tinatawag din nating axis. Okay, and through the remainder of the vertebral column to the first or second lumbar vertebra. Okay, so wag ka nang mag-alala kung nagkaroon ka ng injury within your third, fourth, fifth, okay, lumbar. Okay? Hindi na tatamaan yung spinal cord. Hindi na magkakaroon ng paralysis pero maaaring magkaroon ng pain. Okay? Magkakaroon ka na lang ng slip disc na tinatawag. Okay? Herniated nucleus pulposus. Okay? So ano yung magiging problema naman doon? Magkakaroon ng pain sensations na masyadong makirot. Okay? Very severe. Hindi rin makakakilos. So pag hindi na correct, maaaring ikaw ay makuba o kaya maaaring ikaw ay hindi na rin makalakad kasi mayroong pain sensation. Hindi na magawa ng maayos yung mga weight activities. So the spinal cord descends through your foramen magnum dito simula sa ulo, which is the large aperture of your occipital bone of the skull, through the first cervical vertebrae, or the C1, also known as your axis, and through the remainder of the vertebral column to the first or second lumbar vertebra, also known as your atlas. Okay? So yung atlas, yung taga-support, while the axis is the one revolving the head. Okay? So during movement of your head. Okay. So it conducts sensory information from the peripheral nervous system, right? Which is both somatic and autonomic to the brain. Okay? Conducts sensory information from the peripheral nervous system, both somatic and autonomic to the brain. Okay? Both involuntary and voluntary movements or sensations. Okay? So it conducts motor information from the brain to our various effectors. Okay? Known as your skeletal muscles, cardiac muscles, small muscles, glands. It serves as minor reflex center. Okay? So yun yung epekto na, yung function ng spinal cord. Okay? So spinal cord, simula dito, okay? The central nervous system is your brain, including your spinal cord. Including your spinal cord. Hanggang dito. So ano yung CSF? So pag naipon yung CSF mo dito, tendencies magkakaroon ka ng tinatawag na hydrocephaly. Tapos magkakaroon ka ng bulging of the eye. Okay? Because of increased intracranial pressure. Okay? Increased cerebrospinal fluids will mean hydrocephalus, enlargement of the brain's conductor accumulations of cerebrospinal fluids, thereby resulting to increased cranial pressure, increased intraocular pressure or the IOP. Okay? So, ganyan yung nangyayari. Kahit din sa thyroids, pag meron kang goiter, lumalaki yung thyroid mo, nag-i-increase din yung intraocular pressure. Okay? Or the IOP. So, meron tayong mga ventricles sa utak. Andito yung ventricles. Ventricles are spaces occupied by fluids. So, in cases that there is increased cerebrospinal fluid, okay, flow to the brain. Tapos mahina yung reabsorption into the body back to the central circulation, back to the heart. Okay? So yung mangyayari dyan, increasing cerebral blood flow, walang kulang ng reabsorption, tendencies magkakaroon ng hydrocephalus yung patient. Okay? Okay. So we have your spinal cord inside of your vertebrae. Okay? Doon sa may spinal canal, within your spinal canal, meron tayong tinatawag na nerve root. Okay? Ito rin yung tinatawag na intervertebral disc. Ito, intervertebral disc. Ito yung pinaka-cushion natin, shock absorber between the two. So kung meron man, kung nagbuhat tayo ng mabigat, meron kang parang goma dyan. Okay? Parang merong rubber. Once na nagbuhat ka ng mabigat or merong impact galing sa taas, sa ulo, o kaya baliktad. Okay? So kahit kumalon ka, pagbagsak mo, merong impact. Okay? So it will be absorbed by your intervertebral disc. Okay? So what if nagkaroon ng tinatawag na slip disc between your two vertebrae? Okay? So kung nagkaroon ng slip disc between your two vertebrae, okay, nag-slide, also known as your herniated nucleus pulposus. Okay, ito na lang para mas maliit. Ito yung vertebrae mo. Ngayon, nag-slide siya o musli. Okay? Herniated nucleus pulposus. Tapos naipit ngayon yung tinatawag mong nerve root. And yung magpupulse ng varus vertebrae. Okay? So ang ginagawa doon, if ever na naiipit, yung nerve root na yan, tinatanggal yung tinatawag mo intervertebral disc. Okay? Kaya nababawasan yung height ng patient dahil yung shock absorbent mo doon, okay, in between your vertebra, tinanggal. Okay? During the operation, yan yung tinatanggal. Lumiliit yung height mo at saka iwasan mo nang magbuhat ng mabigat. Okay? Lalo na yung squatting ng bar ng barbell. Okay? So, iniiwasan natin yan. Okay? So, napaka-importante ng body positioning, correct body positioning during lifting of heavy object. Okay? Kasi kung may mga bending, tapos na nagkaroon ka ng slip disc, katulad ni interloxin. Okay? Diba? Dapat siya yung darna sa ABS-CBN, pero hindi na tuloy. Bakit? Dahil nagkaroon siya ng slip disc habang nagbubuhat ng barbell. Okay? Dahil sa sobrang bigat. Okay? So nagkaroon siya ng herniated nucleus pulposus. Okay? Tapos yun din yung dahilan kung bakit siya tumataba ngayon. Maybe meron pang pain, kaya meron pa siyang steroid therapy resulting to increase body weight. Okay? Tumataba. Yun yung epekto ng steroids. Okay, so we have the sensory pathway. Okay? So pathways are either ascending or apparent that allows sensory data, okay, such as the feeling of burnt hand to become conscious perception. Paakyat, papunta sa ulo. Sensory pathways natin yan. Ascending, withering, descending. Okay? So pag na-transmit na yung signal, na-receive na ng neurons natin, umabot ng brain, it will be perceived. So sensory, paakyat, perception is pababa. Okay? So after ng perception, the result would be motion, right? Or action. So it is ascending or apparent to allow sensory data such as the feeling of a burnt hand to become conscious perception. Okay? So dito magsisimula sa kamay, aakyat, pupunta ng posterior root of the spinal cord. Okay? So sabi ko nga nung nakaraan, kung naalala ko, during my discussion of musculoskeletal system, okay? So, meron kang first order neurons. Then you have the second order neurons, which is your posterior root of the spinal cord, or also known as your dorsal horn. And then you have your third order neurons. Okay? So in the first order neuron is the sensation of surface tissues. Okay? So dadalhin dito, the second order neurons, hindi pa muna darating dito, pero meron ng response. Dito pa lang, magkakaroon na ng response, tinatawag natin reflex. Okay? Pagdating dito, merong response, withdrawal reflex. Okay? So tatanggalin yung kamay dahil napasok. Tatanggalin sa nahawakang kaldero. Okay? Tapos, tuloy-tuloy yung transmission aabot ng brain. Okay? So, ano yung mangyayari pag umabot ng brain? Saka pa lang ipiperceive ng brain, mainit yung nahawakan ko. Pero nauna na yung reflex. Okay? So, sensation, reflex before your perception. So, kung tatanong, ano yung mas nauuna, yung reflex ba or yung perception? It is your reflex. Okay? Sensation, reflex, then saka pa lang magkakaroon ng perception of your sensory stimuli. Okay? So, bago mo pa maisip na merong pain sensation, nauna na yung kamay mo. Okay? To prevent such injury. Okay? So, meron pang terminal dito. Alam mong paabot dito, pero dito pa lang meron ng initial action yung katawan mo. Okay? Para maiwasan yung injury. Okay, so while your sensory pathway is ascending paakyat, then we have also your motor pathways. Is your motor pathways, kabaliktaran naman. Ito yung descending or the efferent. Okay, kanina apparent. So ngayon yung efferent or the effect of the sensation perceived your brain. So kung meron tayong cause kanina, kaya nagkaroon ng sensation, meron tayong ngayon effect or the motor pathways. So motor pathways starts with your transmission of impulse from the brain to the muscles. Okay? So ito kanina, naramdaman, okay? In your sensory, naramdaman sa kamay, nagkaroon ng pain sensations, interpreted by your brain, and then your brain, nag-utos ngayon siya through your motor pathways, inutusan, dumating dito, umabot ng skeletal muscles. Okay? Uutusan niya ngayon para magkaroon ng withdrawal. Okay? So, ganun yung motor pathways. Tatanggalin. Kung hindi man nagkaroon ng withdrawal, tatanggalin. Conscious removal of your hands and hat surface. Okay? Meron tayong conscious removal. Kanina, involuntary reflex. Okay, so we have spinal reflexes do not depend on conscious perception. Okay? It do not depend on conscious perception and interpretation of stimuli. Okay? Ito na yung sinasabi ko. Ang hindi umabot ng brain, ibig sabihin, unconscious withdrawal. Okay? It's a reflex. Okay? Body action. Na hindi mo kailangang umabot ng utak para magkaroon ng response yung katawan. It's a body defense to impending or present danger or injury. Okay? So reflex is your body protection against impending or present injury. Okay? So hindi niya kailangang maging unconscious. Okay? It is not a deliberate action. In other words, they do not involve the brain. Okay? They occur involuntarily with lightning speed and are identical in all healthy children and adults, although they are less developed in infants. Okay? So dun pa lang sa second order neuron, sa dorsal root ganglion, magkakaroon na ng effect using by way of your spinal reflexes, not by way of your motor activity. Okay? So what is peripheral nervous system? Peripheral nervous system consists of your cranial nerves, okay? Spinal nerves, cranial or spinal nerves, and then the peripheral autonomic nervous system, okay? So ito yung pag-uusapan natin, okay? The central nervous system, cranial nerves, under your peripheral nervous system, the spinal nerves, and then the peripheral autonomic nervous system. Okay. So you have the cranial nerves. So meron tayong 12 cranial nerves. The 12 pairs of cranial nerves originates from the brain and are called peripheral nerves of the brain. Okay? Peripheral nerves of the brain. Central nervous system, pero cranial nerves is under your peripheral nerves of the brain. Okay? So any damage to the peripheral nerves of the brain will affect this one. Okay? Will affect this, your 12 cranial nerves. So ano ba yung cranial nerves natin? Number 1 is your olfactory. Number 2 is your optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and hypoglossal. Okay? So, O, to touch and feel, virgin girls. Okay. Virgin girls. Vagina, so heaven. Okay. Yun yung madaling tandaan natin mga mnemonics regarding cranial nerves. So, mahirap tandaan yung olfactory, optic, oculomotor, trochlear, trigeminal, and so on. Pero mabilis tandaan yung O, to touch and feel, virgin girls, vagina, so heavenly. Okay? Meron pang ibang tawag dyan. Alto bando tower top of Filipino Army need help. Okay? So, iba naman yung okay. So, what are the functions of your different cranial nerves? So, for the olfactory, so S stands for your sensory, M stands for your motor, okay, functions. So, for the olfactory, meron pang letter B pala. Yung letter B is both sensory or motor functions. Okay, meron siyang dalawang functions. So for the olfactory, we have the sense of smell, okay? Optic nerve, sense of vision. Oculomotor is for the eye movement, pupil constriction, okay? Now, meron tayong perla. Pupils are equally round, reactive to light and accommodation. Okay? Then we have your trochlear nerve, eye movement. Okay, motor movement siya, eye movement. Trigeminal nerve is for somatosensory information, such as touch and pain. Okay? Okay? Saan makikita yung somatosensory information of touch and pain? So, nasan yung trigeminal in the face and head? Okay? So, meron tayong nandito yung trigeminal nerve natin. Okay? So, kung meron kang tecdoloriox, ito yung ina-assess. Okay? So, piniparkas yung cheekbone. So, kung meron kang tecdoloriox, okay? So, magkakaroon ng pain sensation at saka movement with your facial expressions. Okay? So, trigeminal nerve also functions for muscle for chewing, okay, in the muscles for chewing, mastication. Okay, abducen nerves is for the eye movement, abducen, eye movement also, oculomotor, eye movement, abducen, eye movement, facial nerve, trigeminal, facial nerve. Okay, para saan yung facial nerve? Dalawa, katulad ng trigeminal. Okay, so yung kaibahan nga lang ng trigeminal, it is for touch and pain and mastication process. For the facial nerve, somatosensory information from the air, okay, sense of taste also, okay, that controls muscles used in the facial expression, okay. Okay. Okay, so cranial nerve number 8, we have the vestibulocochlear, okay. Vestibular is for the sense of balance, cochlear is for the sense of hearing, somatosensory, sensory, okay. Glossopharyngeal nerve, okay. So, 1/3 posterior, nasa likod ng tongue natin is your taste, yung nasa dulo. Somatosensory information from the tongue, tonsils, and pharynx, that's another function. Then we have controls some muscles used in swallowing. Okay? So, paglunok, there is movement of the tongue, kaya movement din yung, or for motion din yung glossopharyngeal nerve. Okay? Okay, so we have the vagus nerve, okay, for the number 10, okay. So para saan yung vagus nerve is for the sensory, motor, and autonomic functions of the viscera, okay. So saan makikita? Sa diaphragm, okay. Sa puwet, stimulate yung vagus nerve. So pag umiri ka, okay, during constipation, may ere para mailabas yung pupo, it will increase your heart, okay. So, yung pag-ire, tinatawag din natin Valsalva maneuver. Okay? In some cases, yung Valsalva maneuver is not good for the heart. Okay? It may elicit or may predispose the cause of your heart stroke. Okay? Kaya nga, yung mga pasyente na nagkakaroon ng increased blood pressure, so pag nag-Valsalva maneuver, they are prone to having heart stroke. Okay? So ano yung gagawin? Binibigyan yung mga pasyente ng lactulose, okay, pampadumi, para sa umaga malambot yung dumi, automatic dudumi, hindi na magkakaroon ng Valsalva over effort. Ano yon? Para hindi ma-stimulate yung vagus nerve, hindi magkaroon ng increased heart rate ng patient, thereby decreasing the possibility of heart attack. Okay? So, ganun yung importansya ng vagus nerve. Okay, so we have stimulation also of vagus nerve may cause increased gastric acids glands. Okay, gastric acids. So once na tumaas yung gastric acids mo because of your vagus nerve, kang magkaroon ng gastroesophageal reflux disease, yung isusuka mo yung mga acids ng stomach. Okay, so that's one also the result of stimulation of your vagus nerve. Okay, number 11, we have your accessory nerve or the spinal accessory nerve. Okay. So ano naman yung spinal accessory? Okay. It controls your muscle used in the head movement. Okay. So i-assess mo ngayon, flexion and extension, adduction and abduction, okay, of your head. Okay. So yan yung mga activities natin for the accessory nerve assessment, okay, examination. Okay, number 12, you have your hypoglossal nerve that controls the muscles or of the tongue, controls the muscle of the tongue. Okay. Okay, so we have spinal and peripheral nerves. Gano'n ka-importante yung spinal and peripheral nerves? The spinal and peripheral nerves are the branching from the spinal cord, 31 pairs of spinal nerves. Okay? So 8 in the cervical area, 12 in the thoracic, 5 in lumbar, 5 in sacral, and 1 in coccygeal. 1 in coccygeal. Okay? So, ang pinaka-importante, isa sa pinaka-importante dito sa coccygeal, sa coccyx, yung sciatic nerve. So, once na ma-hit, okay? Kasi meron tayong mga 10 cc administration, okay, or 10 ml of medications given in clients. Okay? So, kadalasan, pag masyadong malaki yung number or amount ng liquid na ibibigay intramuscular injection, so sapit yung administration on not your deltoid muscles kasi hindi kakayanin ng deltoid. So pinakamalaki yung area ng muscles is your buttocks, so doon binibigay. Okay? So yung iniingatan natin when giving medications in your buttocks area is your sciatic nerve. Okay? So yun yung tawag natin doon sa 1 spinal nerves in the coccygeal, sciatic nerves. Okay? So damage to the sciatic nerve will may paralyze your lower extremities, yung dalawa, will cause paralysis. Okay? So damage also to your 8 cervical, okay, will cause also paralysis, thoracic, ganun din, lumbar, sacral. So the same with your paralysis and pain, ha? Hindi lang naman paralysis lang. Okay. So sometimes, pag naipit yung mga cervical vertebra, thoracic vertebra will cause pain in the back, okay, of the body. So while kung tinamaan naman, yung na-damage is your spinal cord mismo, okay? Ito kasi branching lang ng the spinal nerves from the spinal cord. Pero kung na-damage yung spinal cord mismo, will cause paralysis. So the spinal nerves contain both ascending and descending fibers. So ascending is for the sensory, descending fibers is for the motor neurons. And although there is some overlap, each is responsible for innervation in a particular area of the body. Okay? So meron kanya-kanyang trabaho. Although merong overlapping sometimes, okay? So it is the body's protection also. Kasi kung walang overlapping, maaaring pag na-damage yung isang nerve, hindi na magkakaroon ng function. Okay? Mawawala yung functions ng area na naka-innervate doon ng peripheral nerves or spinal nerves. Okay? So kung merong overlapping, kahit na-damage yung isang nerve, magpa-function pa rin ngayon yung area or yung organ. Okay? So ito yung mga nerves natin, okay? Spinal and peripheral nerves. Okay? So for the spinal nerves, you have the cervical plexus, brachial plexus. Okay? So dito, pag na-damage yung cervical nerves mo dito, paralysis, quadrant paralysis, quadriplegia ang tawag. Okay? The 4 extremities, magkakaroon ng paralysis. Kung dito naman yung damage mo, in the cauda equina, in the sciatic nerve, okay, the damage will be the lower extremities. Okay, pataas ng pataas, okay, the involved organs, depende kung nasan yung damage. Okay, kung tumataas, halimbawa dito umabot, kung dito lang sa sciatic, it is your lower extremities. Kung dito umabot, it will involve your urinary bladder, the reproductive organ. Pag pataas ng pataas, tingnan nyo to. Yung area na to, ito yung spinal cord. Pagdating dito, tapos na yung spinal cord. Okay? So pataas ng pataas yung damage ng nerves at saka ng spinal cord. Pataas din ang pataas. At padami ng parami rin yung involved na organs. that may have paralysis or pain sensations, okay, or damage. Okay, so we have dermatomes are regions of the body. Dermatomes are considered as your first order neurons. Okay, so in the dermatomes, they are the regions of the body innervated by the cutaneous branch of the single spinal nerve. So cutaneous, okay, ibig sabihin, skin, okay, superficial, okay. So we have different locations of our dermatomes. Okay, cutaneous yan. So the first order of neurons is your dermatomes, on the surface of the body. Okay. Second order of neurons is your spinothalamic tract. Okay. Yung mga nerve innervations. Kanina. Okay. From your C1, C2, C3, C4, C5, C6, T1 to T12 to S1 to S5, and then your coccyx. Okay. Yung mga nerve innervations doon na tinatawag natin spinothalamic tract, yun yung second order neurons. The dorsal root and the ganglion. Okay. The third order neuron is your brain and your spinal cord. Okay. Okay, so that's all for your, this is then for the review of anatomy and physiology. Then let's come to the components of neurologic exam. Okay, so before conducting the neurologic exam, we have also to conduct a physical assessment. What are included in your physical assessment? Okay. So the nursing interview guide, subjective data of the client, current symptoms may include questions such as number one, headaches, reasons of headaches, numbness or tingling sensations. Okay. Meron bang pain sa ulo? Meron bang numb or paresthesia in other parts of the body or the tingling sensations? Okay. Ibig sabihin, maaaring merong ipit na nerves. Okay. Meron bang seizure and activity that may affect your brain? Okay. Because of ischemia. Number 3, we have dizziness, lightheadedness. Okay. Nahihilo ba? Okay. Or problems with balance or coordination. Mabilisan na lang ha, kasi na-discuss na natin yung ibang topics na to. Okay. Another conditions is we have number 5, the ringing in vision. Meron bang naririnig na tinnitus? Okay. Or pain, ringing in the vision. Mali yung binigay na checklist sa akin. Ringing in the hearing situation. Change in vision. Yung ringing sa hearing yun, hindi sa vision. Change in vision, meron bang pagbabago? Okay, lumalabo ba yung mata? Habang palayo ba? Mas malabo? Pag mas malapit ba, malinaw? O baka naman mas malapit, malabo? Pag lumalayo, mas malinaw. Okay? So yun yung mga changes in the vision. Okay? Maaari din parang nilaglagan ng kortina, maaari din yung tinatawag natin unti-unti. Okay? Nagkakaroon ng changes. Nabablock yung area na yun. Okay? Nalaglagan ng kortina. Falling on the curtain is a signs of retinal detachment. Tunneling of vision, yung sensations na habang palayo ng palayo, parang lumiliit yung field of vision is a sign of your glaucoma. Okay? So from this area, palapit ng palayo ng palayo, paliit yung field of vision is a sign of your glaucoma. So number 7, we have difficulty understanding when people are talking to you or when you talk to others. Okay? Hindi mo na ma-process ng maayos kung ano yung sinasabi. Maaari sa cases ng mga pasyenteng merong problema sa pag-iisip o kaya merong damage yung brain. Merong difficulty in swallowing. Okay? Number 8. Number 9 is the loss of bowel or bladder control. Number 10, we have also memory loss. Hindi na matandaan kung ano yung nangyari ng nakaraan. Maaaring retrograde, anterograde. Okay? or maaaring may cheat yung loss of memory. Okay? So we have also to assess past history of head injury, cases of meningitis, encephalitis, spinal cord injury. Meron bang cases ng nahulog ng pasyente? A history of stroke. What are the treatment being received during those cases or problems with your health? Okay. Assess also for or ask also for the family history of high bloods. Okay. Family history of stroke, family history of Alzheimer's. Okay. Kasi ito yung mga namamana. Cases of epilepsy, the family brain cancer in the family, Huntington's disease in the family. Okay. Assist also for the lifestyle and health practices. Meron bang mga prescription or non-prescription medications that you are taking? Are you taking histamines, antihistamines, or are you taking antihistamines and other medications? Epileptic drugs, are you taking it? Okay. Epileptic drugs, when you take epileptic drugs, may cause for secondary cause of your flip and palate anomaly in children. Okay? Maaari ding mag-cause ng autism kung merong anti-epileptic drugs na tinitake. Okay. So, for the mother of those children sa may mga damage yung brain. Okay? Another lifestyle and health practices na kailangan mo itanong, meron bang nag-i-smoke ba yung patient? Bakit? Kasi yung smoking decreases your arteries and veins. Okay? It decreases the size of your blood vessels, thereby resulting to ischemia or decreased oxygenation in the different parts of the body involving your brain. Okay? Number 3, wearing of seatbelts and protective headgear. Bakit? Kasi maaaring yung pasyente nag-undergo ng whip splash injury. Parang pinato pa sa ulo. Ganun. Okay? Bakit? During the vehicular accidents, sudden impact of the vehicle, ramming of the vehicles into object, trees, or whatsoever may cause a whiplash injury of the neck. Okay? Kung biglang gumaganon yung pasyente. Okay? During the impact process. So, maaaring yun yung isa sa ina-assist natin kung nagsusuot ba ng seatbelts pag sumasakay ng vehicle o kaya nagsusuot ba ng headgear or helmet. Okay? Number 4, we have the daily diet of the patient. I-ask din natin sa lifestyle, exposure to lead, insecticides, and pollutants or chemicals. Or in some cases, ano ba yung trabaho ng pasyente? Maaaring palaging nakatapat sa computer. Okay? So, positioning will affect your may cause fibromyalgia. Halimbawa sa akin, nagkakaroon ako ng fibromyalgia. I am in front of my laptop for 7 to 8 hours or more. So, nagkakaroon na ng pain sensation yung neck. Okay? So, another, we have exposure to lead, okay? Insecticides, pollutants, and chemicals. Okay? So, lead is one of the cause of cancer in the body. Okay? So, ano yung lead? Ito yung makikita natin sa mga batteries. Okay? So, meron bang exposure? May baka naman mekaniko, itatrabaho sa mga batteries or whatsoever. Okay? So, insecticides. Insecticides, bakit ka lang itanong? It may cause leukemia for children. Okay? So, when you have children below 6 years old, kahit siguro 10 years old, consider them as prone for leukemia when you are using insecticides. So, hanggat maaari, limit use of insecticides. So, kung magkakaroon man o kailangan man mag-spray, umalis muna kayo ng bahay. Okay? Then go back after a few hours. Okay? Of spraying. Tapos, i-open muna yung bahay bago pumasok ng bahay. Somebody and the adult would open all the windows and doors para mailabas yung, tapos tutok yung electric fan palabas para mailabas yung remaining moist or airborne moisture na ginawa na na-spray ng insecticides para hindi malanghap pagpasok ng mga bata. Okay? So avoid the use of mosquito repellents, the use of mga spray. Okay? So iniingatan natin yan. It will cause leukemia to children. Okay? So leukemia is cancer of the blood. Okay? Pollutants and chemicals. Exposure to pollutants and chemicals. At ibang sakit din ang maaaring idulot. Then number 6, lifting of heavy objects in cases of herniated nucleus pulposus or slip disc. Okay, another part of your physical assessment is the nursing interview guide to collect subjective data from the client. Okay, number 7, kasama dito yung meron bang frequent repetitive movements. Okay, baka naman merong Tourette's, ba? Pag-usapan natin yung Tourette syndrome. So ito yung mga considerations natin. Frequent repetitive movement may cause problems with motions and body movements of the patient. Number 8, we have functioning daily activities. Meron bang pagbabago? Apektuhan ba ng mga signs and symptoms yung activities of daily living na nakaka-apekto na, okay? Na hindi mo na magawa ng maayos yung ADL. Okay? So analysis of data is also included in the checklist of the assessment of the neurologic system. Okay? So formulate nursing diagnosis, the wellness diagnosis, arrest and actual nursing diagnosis. Okay? So halimbawa, mga body problems, motor. Okay? So usually, activities yung mga impaired natin dito. Okay? So magkakaroon man ng physical body disturbance, secondary na lang siguro. It is more on the functioning yung number 1 natin, the nursing diagnosis. Okay? When we prioritize. Okay, so we have formulate also collaborative problems with your patient and then make necessary referrals for such cases. Okay. So we have components of neurologic exam. Okay, so we start with the mental status examination. Okay, pero before assessment of the mental status examination, gather equipment first, such as your examination gloves. So, nakuli yata yung slides ko for the okay. So, in the start of your physical examination, the first is yung sunod natin pa rin yung wiper. Okay? So, before you wash your hands, ang gagawin natin is gather first, number 1. The procedure is gathering of the equipment such as examination gloves, pencil, and paper, okay, cotton tip applicators, newsprint to read, okay, para sa optic nerve assessment examination. So, ophthalmoscope, the paper clip, the pin light, snail and chart, sterile cotton ball, substances to smell and taste. Okay, i-prepare natin yan. The tongue, blade, turning fork, tape measure, cotton balls, object to feel, such as test tubes also with hot and cold water. Okay, maaari na siguro dito yung mga glasses natin or cups, okay, for drinking hot and cold water. Then we have also the use of tuning fork, okay, low pitch lang kung meron, and then the use of reflexometer in the assessment of your reflexes, body reflexes. So tuning fork is usually 128 or 256 hertz yung tunog. Okay, this is for the assessment of your French test and reverse test. Okay. Okay, so ensure proper hygiene before seeing the clients. Okay, ensure equipment is properly clean. Okay. So wiper tayo, proper hygiene wiper, wash hands, introduce yourself to the clients, prepare or position the patient. Okay. So explain the procedure to the client and ask the client to put on and down. Okay. So we start with the mental status examination. Number 1 is assessing the level of consciousness. Number 2 is observe appearance and behavior of the patient. Number 3, observe mood, feelings, and expansions. Number 4, observe thought process and perceptions of the patient. Number 5, observe cognitive abilities. Okay. So, dito tayo sa mental status examination. Medyo madami-dami actually ito. Kung susundin talaga yung neurology. So, mental status examination, ano yung mga test natin dito? Okay. It is the assessment of consciousness often using Glasgow-Coma scale. So, you need to use your Glasgow-Coma. So, i-prepare nyo na lang siguro yan. Okay. It is for the assessment of your eye, motor movement or motor responses, eye responses, motor responses, and verbal responses. Okay? So, mental status examination, often including the abbreviated mental score of the AMTs or the mental state examination in MSE. Okay? Glasgow-Coma for the consciousness level. Okay? Mental status examination, MMSE yung gamitin. And then we have also the global assessment of higher functioning. Tapos intracranial pressure is estimated by fundoscopy. Okay. So fundoscopy is also enables assessment of microvascular disease. So what is fundoscopy? Okay, so what is fundoscopy? Usually, fundoscopy is aided by your ophthalmoscope. Okay, so it's a microscope in the assessment or examination of your retina. Okay, so retina is a microvascular part. Okay, the only visible nerves, cranial nerves. Okay, yung retina natin sa exterior. So, maaaring ma-assess using your fundoscopy. Okay? So, kakailanganin ng microscope, ophthalmoscope. Huh? Hindi natin magagawa to without the ophthalmoscope. Okay. Ito rin yung ginagawa. So, paano ma-assess? Ano yung makikita? So, kung merong mga pagliit ng mga ugat sa retina, okay? So, maaaring merong problema yung katulad ng diabetes mellitus na nagkakaroon ng microvascular disease. Okay? Kung merong pagbabara, may cause also such as in cases of hypertension, merong pumuputok ng mga parts ng retina. Okay? In cases of cytomegalovirus, clients with HIV, infected clients. Kung merong endocarditis, pwede rin makita using your fundoscopy. Pero kailangan na siguro ng ophthalmologist dito. Okay? Hindi lang optometrist, but rather ophthalmologist to assist for the possibility of infections, okay, and other diseases that involves the microvessels. Regarding the Glasgow-Coma scale, in the mental health examination, okay, so in the mental status examination, we have to assess the consciousness of the patient using Glasgow-Coma scale. So yung Glasgow-Coma scale natin is used in assessing the behavior of the eye-opening response, the best verbal response, and the best motor response of the patient. Okay? So, dating mo pa lang, sa patient, open naman yung mata, okay? Alert siya. Number 4 na agad siya. Okay? So, there is a spontaneous opening. So, kung tinawag mo yung pasyente, cases na mahina yung pasyente, tapos tinawag mo, sa palang nag-open, okay? So, you consider that as the score of 3. So, kung merong stimulation, okay, binusok mo yung patient, kailangan mong tusokin yung patient. Another stimulation is to make a fist. Okay? Ganito yung fist. Sorry. Ganito yung fist. Yung dito niya, irarap mo dito sa mid-clavicle ng patient. Okay? Irarap mo dito. There is pain stimulation here. So kung nagkaroon ng eye response or eye opening with the stimulation, okay, to pain, number 2 yung result ng eye opening response. So if there is no response, 1 yung score as long as buhay yung patient. Okay? So for the verbal response naman, kung ang patient is oriented to time, place, and person, tinanong mo, anong pangalan mo, nasaan ka, alam mo ba yung nangyayari sa'yo? Okay? O kaya kung maayos sumagot yung patient, it is considered as oriented to time, place, and persons. So the best score niyan is number 5. So kung medyo confused yung client, hindi alam kung ano yung nangyayari, number 4 yung patient. Okay? Yung result, yung score. So kung inappropriate words yung sinasabi, okay? Maaring confused kasi, pero hindi inappropriate words yung sinasabi. So kung inappropriate words yung sinasabi, okay? Sinabi mo, ano ito? Sasabihin sa iyo, ano yan, bote. Okay? So inappropriate words yun. Okay? So, dapat sasabihin tasa. So inappropriate words is number 3. Incomprehensible sounds naman, number 2 yung results for the verbal response. Okay? Kung no response yung patient, okay, pero buhay yung patient, number 1 yung result. Okay? 0 kung patay yung pasyente. Okay? So best motor response naman, okay? So when the patient is able to obey commands, number 6, moves to localize pain. Kung meron kang inintroduce na object, ba, tinusok mo ngayon, pasyente, ng matulis na bagay, tapos nagkaroon ng withdrawal. Okay? So there is movement to localize pain. That's considered as number 5. Kasi kaya niya panggalawin yung katawan niya. Okay? Sorry, iba pala yung reflex. So flexion withdrawal from pain is number 4. Conscious removal. Okay? Conscious action of removing the body parts na pain sensation. Ang bawa, tinusok mo tapos alam niya kung nasaan at saka kaya niyang tanggalin yung pain, yung body parts na yun doon sa kaya niyang iiwas, it is considered as moving to localized pain, a conscious withdrawal. So kung non-conscious, which is your flexion withdrawal from pain, biglaan, so that's considered as number 4. So abnormal flexion, decorticate position, ito ba yung decorticate? Pagganang ng pasyente. Okay? Merong tama yung utak niyan. Napaganon yung pasyente. Okay? So that's number 3. Meron akong pasyente dati naka-decorticate yung position, nakaganito na lang, kasali sa ethnic group, taga Isabela siguro yun. Okay? So mother siya, nagkaroon ng damage yung brain. So naka-decorticate position ang pasyente. Naalala ko kasi doon, nagtanggal ako ng catheter. Tapos yung catheter, pagtanggal ko ng catheter, pag-detach ko ng catheter sa urban, tumalsik yung ihi ng pasyente sa mukha ko. Okay? So that's one of my stories regarding decorticate positions. It is abnormal flexion. Okay? So abnormal extension naman kung naka-stretch. Kung naka-stretch yung pasyente, taas nakaganon lang yung kamay. Okay? So taas nakaganon yung positions kasi niya nakaganon. Taas nasa sa. Okay? So stretch yung body pero palabas yung palms ng hand naka-close tapos palabas yung it facing outward. Okay? So that's the cerebrate position, abnormal extension of the body. So that it is scores number 2. Okay? So if there is no response, okay? If there is no response, the result is 1. That's for Glasgow Promise scale. Okay. So for the mental state examination naman, okay. So, mental status examination, you're using your mental state examination. Medyo madaming tanong dito. Okay? So, what is a mental state examination? It is also known as your Holstein test. Okay? A 30-point questionnaire that is used extensively in clinical and research settings. Okay? For patients with cognitive impairment, to measure cognitive impairment. So, cognitive lang sa mental state examination. It doesn't involve your the ability to move. Hindi katulad ng Glasgow coma that involves the eye opening, the verbal response. Okay? Ito, puro cognitive lang or yung verbal, appropriate verbal response lang ina-assess. Okay? So more on the cognitions. Okay? So ano yung mga category at possible points dito? Okay? So in the mental state examination, you assess for the orientation to time. Assess for the orientation to time. So kung from broadest to most narrow, okay? So kung maayos yung response ng patient na identify kung anong oras, anong minuto ngayon, based on the estimate of the sun, okay? So kung kaya niya yon, okay, it will be scored as yung pinaka-highest dyan is number 5. Okay. So for the orientation of the time, possible points, highest is 5. Orientation to place, possible points, number 5 also, the highest. Registration or repeating the name, okay? Yung mga prompts mo, pag pinaulit mo yung mga pangalan, tapos kaya niyang mag-register, kaya niyang maalala, that's the score of 3. Okay? Highest possible points, mga pangalan, ulit-ulit. Okay? So attention and calculation, kung kaya niya ng mag-spell ng word na backwards. Okay? Mga words. Okay? So number 5. Okay? Pwede rin serial sevens na tinatawag. So, alamin niyo yung serial sevens. Okay? So attention and calculation. So sometimes we keep mathematical operations for the patient to calculate mga simple mathematical calculation. So kung nagawa niya, huwag naman yung mga square root na yan. Hindi niya yan magagawa kung normal, kung mababa yung pinag-aralan. So normal, subtraction, addition, multiplication, and division will do for the attention and calculation. So possible points for that, kung maayos yung pagsagot ng pasyente, is number 5. Okay? Okay, so we assess also in the mental state examination, sure, is the patient's ability for a recall. Okay? Registration recall also. So kanina promise naman, maaaring ipaulit mo kung ano yung mga activities. Pa-identify mo kung ano yung mga activities na ginawa na ninyo o ano yung mga tanong na na-raise mo kanina. Okay? So that's possible points for that is number 3. Okay? So language, naming a pencil and a watch. Okay? So meron kang lapis, meron kang relos, papaalala mo lang o itatanong mo lang kung anong pangalan ng mga objects. Okay? So number 2 yan. Possible points is 2. Okay? Repetition or speaking back a phrase. Kung kaya niyang ulitin ng maayos, that's considered as possible points is number 1. Maximum points is number 1. So for the complex command, yung points niyan, yung pinakamataas na points niyan is 6. Okay? So ano-ano yung pwede mong ipa-draw. Pwede kang magpa-draw. Okay? So pag nagawa yung mga complex commands na yon ng maayos, number 6 yung points niya. Total of possible points of 30. So puro abilities ng utak yung ina-assess dito. Okay? No assessment of movements or muscles. Okay. For the mental state exam. So global assessment of natin. Okay. Actually, in the mental status examination, the most important is the Glasgow Coma Scale. For the assessment of mental status examination using your mini-mental state examination is para to sa mga pasyenteng merong mga mental disturbance. Okay? So, in case dito sa inyo, dahil mga second year college pa lang kayo, second year college nursing, yung focus is the Glasgow Coma Scale. Okay? So, mental status examination using your Glasgow Coma Scale. So, yung fundoscopy for the intracranial pressure, mahirap to kung wala kang ophthalmoscope. Okay? So, we have cranial nerve examination. Okay? So, cranial nerve examination. Okay. So, i-discuss natin ito mamaya yung cranial nerve examination. Okay, so for the motor, so assessment of the muscle strength, okay, often graded in the muscle in the MRC scale, okay, motor response, 1 to 5. So, assess natin dito yung muscle tone, sense of rigidity, okay, muscle tone, kung gaano katigas yung muscles, rigidity, kung gaano matigas din to, pero ibang rigidity. Iba yung tone at yung rigidity. Yung tone is the normal. Yung rigid is abnormal. Okay? So, examination of postures, cerebrate, decorticate, hemiparetic. Okay? So, the cerebrate is abnormal extensions of the body. Okay? Stretch yung arms, stretch yung legs. Tapos yung arms, nakaganon. So, facing outward, nasa sides ng body, pero facing outward yung palms area. Decorticate is abnormal flexion of the body, nakaganon. Okay? Hemiparetic is paralysis of the body. Okay? Hemi, okay? Vertical yung hati. So, maaaring pag-damage yung right side of the brain, the result is kung damage yung right side of the brain, yung damage is the left part of the body, yung dalawang extremities, both the hands, the left hand and the left legs will be included in the paralysis. Hemiparetic yung tawag natin dyan. Okay? So, pag sinabi namang paraplegic, lower body parts. Okay? Paralysis of the lower body parts. Pag sinabi namang quadriplegic, it involves the 4 extremities, the 2 ends, okay, the upper extremities, and including or lower extremities. So heme, para, and the umbilical down, then quadra from the neck down. Okay, paralysis. Okay, so we have also the wrestling tremors, as is for the wrestling tremors of normal movements of the body, including seizure. Hindi ko mabasa. Assist for the tone, spasticity, ang pagpitik, okay? Pronator drift, okay? Rigidity, cogwheeling, or the abnormal tone. Secondary to Parkinson's disease, Gegenhalten, or the resistance to passive change, or the strength of antagonist muscle increases with increasing examiner force. Okay, the more you force the patient, okay, the more the resistance. Okay. Okay. So we also need to assist the depth tendon reflexes, including the masseter, the biceps, the triceps, the tendon, the knee tendon, the ankle joint, and the plantar, the Babinski reflex, the breast reflex, okay? The pyramidal tract, the lower motor neurons, the peripheral nerves, the motor inflate using reflex hammer, okay? So we need also to assist the sensory system involving provoking sensations of fine touch, pain, sensation, temperature, okay? Fine touch, pa nga dito, can be evaluated with monofilament test touching various dermatomes with 9 monofilament. Okay? Ibig sabihin, paggamit ka ng balahibo. Okay? In the sensory, we will assess or examine for the light touch, the temperature, the position change. Okay? proprioception yon. Position sense. Stereognosis. Okay. And the two-point discrimination. Okay. Pain, vibration, and graphisticious. Okay, so for the cerebellum, okay, the cerebellar testings will include dysmetria, the finger to nose test, ankle over tibia test. Okay, mamaya i-discuss natin yan. Dysdedokinesis, na-discuss na natin sa musculoskeletal assessment, rapid pronation and supination. Okay, so for the movement of the muscles, the finger to nose, ankle over tibia. Okay, under that is for the Romberg test. Okay, rapid pronation and supination is your RAM, rapid arm movement. Okay, ataxia, or for the assessment of gait, under Romberg test, presence of nystagmus, intention tremors, staccato speech. Okay, so yan yung mga kasama under cerebellum. Okay, so ito na. So, ensure proper hygiene, washing of the hands, equipments, secure your equipments, thermoscope kung meron, pero kung wala kang magagawa. Kung wala kang test tubes or other vials for the hot and cold, you can use cups and bottles. Okay? So, ito lang yung kailangan mo, yung BP cup and light vest of cotton. Kung wala, balahibo ng manok. You use turning fork and sterile gloves, tongue blade. Okay? Lalo na kung there will be assisting non-sterile gloves, you use non-sterile gloves, you are assisting the tongue. Okay? Reflex hammer, the use of for the reflexes, sharp objects, toothpick, and sterile needle. Gagamit tayo niya. Okay? For the assessment of withdrawal, reflex. Okay? So, secure ka rin ng coin, button, key, or zipper clip. Okay? Secure din ng something fragrant such as rubbing alcohol or coffee. Something to taste such as lemon juice or sugar or salt. Okay? So for the hot and cold surface, and then assessment of your pain sensations, assessment of touch, assessment of smell, you can use coffee, hot coffee. Okay? So isa na lang i-prefer mo. Okay? Something to taste must include lemon juice, sugar, salt. Okay. Coffee can also be used. Okay. So after that is the introduction of yourself to the client. Then after introduction, informing your clients about the procedure, okay. Identifying also the client. Tatlong ayan. Introduce yourself. Okay. Identify your client and inform your client. Tatlong I. 3 I's. Introduce, identify, and inform. Okay, so assessing the mental status examination. Okay, so assess the patient for the appearance, the hygiene, grooming, and odor of the patient. Okay, so sa appearance pa lang, magkakaroon na tayo ng maayos assessment dito. Kung maayos yung appearance, okay, so normal yung patient. In terms of mental status. Kung maayos yung hygiene, maayos yung grooming. Pero hindi naman ibig sabihin na hindi maayos yung hygiene, hindi maayos yung appearance, meron ng problema sa mental status. It's just a one way of knowing kung maayos yung mental status ng patient, including grooming and odor of the patient. Okay? So, to begin the assessment, as the patient approaches you, titingnan agad paano natin. Okay? So, doon pa lang, you observe the patient and the gait of the patient, observe the general appearance, the height, the grooming, and the odor of the time. Okay? I remember in my during my wife's registration to PRC, okay, registration, kumuha ulit ng bagong PRC ID. So, yung naalala ko doon, yung isang babae na lumapit, tumayo sa harap ko, habang ako'y nakaupo at nakapila rin yung asawa ko. Merong isang babae na tumayo sa harap ko, tapos yung damit, hindi naman maayos naman yung damit, maayos yung problema nga lang, yung shirt niya is nakababa masyado. Tapos nakalabas yung 1 inch ng pubic hair. So, during that, umandar agad yung pagiging nurse, assessing the mental status of the patient. Either, hindi lang niya naramdaman, o kaya talagang she is um, uh, craving for attention. So, yun yung isa sa mga hindi ko makalimutang anecdote ng buhay ko. Okay? Somebody in a location wherein professionals halos lahat ng tao. So either registering for a licensure examination or securing license again. Okay? Halos lahat doon na mga educated tapos meron pang isang makaka-enkwentro or makakaharap na posibleng merong problema with mental status.